Hi, I'm Jackie from Grady Legal, and thank you for joining me on Sick Degrees of Separation. Obviously, today we're going to talk about the coronavirus. I posted a video a couple weeks ago talking to individuals about how to prepare, not to panic. I'm starting to see small business owners and employers begin to panic a little bit, and rightfully so. We're all expecting a huge contraction in the economy, possibly having to shutter our doors for a little bit. We don't know. Everyone's a little bit on edge. And I see a lot of business owners saying, well, I'm going to go look at my general liability policy to see if this is covered as a business loss. People, you got to start looking at your healthcare benefits. If you have employer-sponsored benefits in your company, you need to start understanding what those benefits are. Now, we all know that the actual test for the coronavirus is being provided allegedly free of charge, but the treatment is not. And the treatment is going to require hospitalization, respirators, ventilators, a stay in the intensive care unit, or if we get inundated with these types of cases, a makeshift intensive care unit. And one of the issues with the coronavirus is that this is not a quick recovery for those that get seriously ill. We have people that are staying in the intensive care units for long periods of time. So we can expect to see huge medical bills coming out of this. So if you are a self-insured company, you need to take action now, because you need to get ready to ensure that you don't get hit with a large amount of claims if this gets a foothold in your workplace. If you're fully insured, you're not going to see it as much because your insurance is paying for it. However, you can expect to see a huge jump in your premium if your workforce is sick and needs to go into the hospital. So something to really think about. You really need to start talking now to your employees about preventing getting sick, what to do if they start to not feel well. Because one of the other issues that no one's really talking about, it's called the worried well, right? And those are the people that wake up with, maybe a little bit of a cough or maybe a little bit of a sniffly nose, and they get nervous. And they go to the hospital, they go to the ER, they go to their primary care physician because they want to get tested. And that's okay, but I think in a lot of places, they're advising to call ahead of time. There are ways to sort of, figure out, is someone really needs the test at this point? Is someone really suffering? Are they really showing the signs? Or is it just, a little morning congestion or an allergy or something along those lines? So you'd also want to prevent your employees from driving up your claims by having to go to the emergency room when they really don't have to. So now you need to talk to your employees about the facilities that they should be utilizing if they don't feel well. Look at your insurance, see what the best rates they have negotiated with different hospitals and facilities. Try to encourage your employees to go to those options versus maybe the more expensive ones. Because at the end of the day, we're expecting to see employers get hit drastically with these claims, from everything from ICU treatment for a coronavirus, and just masses of people who get nervous and go to get checked out anyways. So now's the time to plan. Don't wait until it's too late. This goes without saying. I know a lot of people have been talking about this, but you need to start practicing, your social distancing at work. If you can have employees work remotely from home, telecommute, that's fantastic. If you have to be in the workplace, you really want to encourage people to stay home if they're not feeling well, and you want to encourage them to stay home if someone else in their house hasn't been feeling well. You do not want people coming in unwittingly carrying this virus into your workplace and infecting everybody else. So it's sort of common sense, and we all talk about washing hands. But I'm also telling my employers, you got to be flexible with your sick time and your paid time off policies. Your traditional sick leave has to be suspended. I think we all have to be flexible and work together to get through this. So just use some common sense, start planning now, talk to your broker, talk to your agents, sit down with your HR people and start looking at your healthcare benefits now. Call your lawyer if you have any questions about provisions within the healthcare policy. If you have any questions and you don't have a lawyer right now, feel free to give me a call or shoot me an email. My email is Jackie, Jackie, @gradylegal.com. Our office number is 754-333-0313. We are remaining open throughout whatever happens, we have the ability to work remotely, so we don't envision us closing our doors, but we are here to help our community and help our employers and employees navigate their healthcare benefits through this pandemic. So thank you, everyone, and please stay well.